Parathyroid glands are glands that are in charge of producing parathyroid hormone, and the parathyroid hormone regulates our serum calcium levels, our bone metabolism, and different aspects of our calcium and bone system. We have 4 parathyroid glands typically that are located behind our thyroid, and they are literally small lesions that many times are even hard to find on ultrasound. Sometimes 1 or 2 of these glands become overactive. When they become overactive, they turn into the so-called parathyroid adenomas, meaning a benign parathyroid tumor that produces excessive amounts of parathyroid hormone. And when that happens, parathyroid does multiple things, including stimulating the production of the active form of thyroid, vitamin D, at the kidney level, also increasing the absorption and reabsorption of calcium through our guts, as well as through our kidneys. So everything is aimed at driving calcium levels up. It also activates the reabsorption or resorption of our bone material. So the cells in our bone called osteoclasts that are in charge of removing bone, they become really stimulated and overstimulated by parathyroid hormone and become very active. And they start literally removing bone material and releasing the calcium into our bloodstream. And as a result of that, a typical patient with an overactive parathyroid gland presents to his or her doctors with symptoms of excessive fatigue and weakness, as well as some symptoms of depression, brain fog, constipation. And when the doctor does a blood test, they find serum calcium levels to be high. And with follow-up blood tests, they will find out that parathyroid hormone levels, or the PTH levels, are also elevated. Also, at the same time, parathyroid hormone lowers serum phosphorus levels. So patients have high calcium, low phosphorus, elevated parathyroid hormone levels. And last but not least, because of this excessive parathyroid hormone activity and high levels of calcium, the excess calcium gets spilled over into the urine. So patients with primary hyperparathyroidism have either normal or high urinary calcium concentrations. That's one possibility. The other possibility of parathyroid disease, or category of parathyroid disease, is parathyroid underactivity or hypoparathyroidism. Hypoparathyroidism is literally when the parathyroids are incapable of producing enough parathyroid hormone, or if they do not exist because they have been surgically removed. You typically find hypoparathyroidism in patients who have undergone aggressive thyroid surgery because of their thyroid cancer, and because their parathyroid glands mostly are literally stuck to the back of the thyroid gland as the thyroid gets removed. Many times also parathyroid glands go with them or with the thyroid tissue, and as a result, patients do not have parathyroid glands to produce enough parathyroid hormone. So these patients become hypoparathyroid, and the typical results are low serum calcium levels, and again, phosphorus levels tend to be higher. And as a result of the low calcium level in the blood, these patients develop the so-called tingling and numbness in their hands, feet, or in their face around their mouth, muscle cramps, which is very common, and also rapid heart rate and extreme weakness and serious cardiac arrhythmias that can happen with low serum calcium levels. So it can be a life-threatening condition. Many times these patients tend to visit emergency rooms frequently and seek intravenous calcium infusions to just correct their calcium temporarily. Ultimately, these patients need to be treated with the activated form of vitamin D, which is called calcitriol. These patients also need to be asked to take large amounts of calcium. And as of late, there is a medication that is the form of parathyroid hormone, and it is injectable once a day that replaces the missing parathyroid hormone and really provides a huge relief to these patients who have suffered from this serious medical condition. So that would be the hypoparathyroidism. And then also parathyroid carcinomas are rare, but they can be also found if you look hard enough in patients with overactive parathyroid usually. I have seen very few patients with parathyroid carcinomas, but those were very challenging case of initial hyperparathyroidism or parathyroid overactivity, where parathyroid glands were removed one after the other, assuming that the cause of parathyroid overactivity was your regular parathyroid adenoma, but in reality it was either a parathyroid carcinoma or a parathyroid carcinoma that has metastasized to a different location, such as lungs, and that cancer lesion in the lung or the metastatic lesion in the lung was producing excessive amounts of parathyroid. So they are very challenging, but that's when you really need a team of experts to work together to look for it and to find it and to cure it and treat it by just removing those cancer lesions.